Hello and welcome to Arab Health Week 2021. I'm Sandra Garlick, your host and moderator for today. And whether you're joining us for the first day today on day 3 or whether you've been with us all week, I'm really looking forward to a packed programme for the final day from our expert speakers and presenters. But don't forget, we're here to share best practice, collaborate, innovate, build a community of dynamic, engaged healthcare professionals and learn from each other and collaborate efficiently going forward. Remember, you've got the chat box there, so please use it, please connect with each other, and you've got your connection panel there so you can arrange those meetings and follow-ups afterwards. We want you to connect, we want you to network, we want you to get to know each other from around the globe. Remember, we've got a hashtag Arab Health Week, so please feel free to use that on your social media channels and to connect with us. And do remember that these videos, everything is recorded and you can watch it back on the Future Health YouTube channel. I'm really looking forward to today's sessions. We've got some really exciting speakers coming up for you. So here's what's coming up this morning. We've got cybersecurity, evolving threats during post-pandemic COVID with Ashish Khanna. We've got Dr. Yunus Kazim talking about Dubai's health authority strategy, and Dr. Salman Dalvi, who's going to talk to us about introduction to stem cells and regenerative medicine. I'm really looking forward to these speakers. So without further ado, let's go over to our first technology keynote session, cybersecurity, the evolving threats during and post-COVID-19 with Ashish Khanna.
Hi all. My name is Ashish Khanna, and I am a cybersecurity professional in a government healthcare organization. And I'm here to present to you with the cybersecurity challenges and what we should do during these evolving threats that we are facing in these unprecedented times of COVID-19 pandemic. Before we begin, just a small disclaimer that the contents and thoughts represented by me in this presentation are entirely personal and they bear no resemblance to my current organization or its third parties or its customers, and all photos, logos, or text, etc. is used for representative purposes only and are only a means for educational or any kind of representation. Okay, thank you all for joining. This year, which is 2020, last year, in fact, 2020, it will be the one that will be remembered for a very, very long time. And 12 months ago, very few of us could have foreseen the global disruption that would be caused by COVID-19. It's just the worst pandemic in over a century. And the seismic changes that have affected our lives almost overnight continue to be felt till date. And maybe, hopefully not, but maybe beyond 2021 as well. So as we move forward, I'm going to go through 4 key agenda items. Healthcare, definitely everybody is now well aware of the steps that they need to take, but is it healthcare or COVID has made it like a healthcare in terms of cybersecurity? Then the effects that the nation-state sponsored actors have caused, the threats from these nation-states and criminals to our healthcare systems globally. And it's a very, very big growing concern at this point of time. And how to protect our institutions, healthcare institutions, against various cyber attacks. And last but not least, we'll briefly touch base upon zero trust model for healthcare and how to adopt certain practices that will take us through the zero trust approach. See, with social distancing being critical to slowing the spread of this coronavirus, we needed to transform all the aspects of the way we live, from our working environment to our home environment, to shopping, to interacting with the families and loved ones. The internet has, enabled us to keep our world still running and keep going. And globally, businesses have surprised themselves with the speed and success of these digital initiatives that we have been taken. It's actually has been estimated during 2020, that is last year, the digital transformation had advanced up to 7 years earlier than it is expected, thanks to this pandemic that we are still going through. And it was once thought that it will be almost impossible, that has been achieved in a few months' time. Of course, the giant leap in connectivity and our growing reliance on technology has taken our lives and also brought us with new challenges and problems. Just as organizations worldwide have transformed their ways of working, these threat actors and cyber criminals also changed their tactics so that they could take advantage of the pandemic's disruption. We saw huge spikes in attacks against healthcare entities, and especially in remote working hours. And we have also witnessed, as a cybersecurity professional who has been monitoring such situations daily in and out, that there have been surges in phishing attacks targeting people or workers who are at home or at office, aiming to steal their personal details, their professional working environment details. So there were major increase in ransomware and exploits that was very shameless, and sophisticated hacking attempts have been made against healthcare organizations and companies involved in making, shipping, or even researching on COVID-19 vaccine. See, over 22 billion records have been exposed to data breaches worldwide in 2020 until date, in about 730 publicly disclosed breaches. So you can imagine how many breaches have been, have gone undisclosed at this point of time. At the start of 2020, around March, the major hacking groups like Maze and Doppelpaymer, they pledged to refrain from attacking healthcare institutions, which was struggling to keep up with an increased amount of workload, dealing with the virus insurgencies and dealing with an overwhelming number of patients. But some of the groups even went so far that they announced or gave public statements. They provided free decryption services for institutions who were mistakenly attacked or were subject to attack that they were still recovering from since 2019. Among these groups was a prominent the Maze ransomware group, who committed and issued a public statement saying, that we also stop all the activities versus all kinds of healthcare institutions or pharmaceutical companies. But soon, as 2020 progressed, it became increasingly obvious that such promises, they hold no substance. In fact, in 2020, attacks targeting healthcare institutions, medical institutions, pharmaceutical organizations, and research centers have increased. They were executed at an unprecedented rate. And in April, the Hammersmith Medicines Research Limited, HMR, which is a research firm that was at that time on standby to perform the traits of COVID-19 vaccines in humans, and also they are currently responsible for doing some genome-related studies. They suffered one of the huge data breaches by the same hacking group, which is Maze ransomware group. And then when investigations were done, it was revealed that breach occurred on March 14, almost in parallel to the same time when this Maze ransomware group actually had a public statement being delivered through the internet or Twitter. So as HMR decided not to pay the ransom, the data was published on Maze's designated web page that can be accessed through Tor or other areas of dark web. So shortly afterward, we observed that there was a huge escalation in healthcare-related attacks as threat actors became known about these urgent activities that were going globally. They began focusing on medical facilities, working to mitigate the coronavirus contagion, as well as pharmaceutical institutions working to develop vaccines. This activity continued throughout 2020. As you can see, there is a chart in front of you. This chart demonstrates the increase in attack that is related to healthcare organizations throughout 2020 and close to 2021. If you see closely, recent research has also depicted that October showed the healthcare is currently the most targeted industry in the world. Around 70% of attacks globally from September to October were focused, 2020 that is focused towards healthcare institutions. It also shows a sharp increase of healthcare sector related attacks compared to the global increase in November and December 2020. And then it has also continued in January 2021. Until date, healthcare is the second most attacked industry in the world after banking. And even in the UAE, it was considered that 2020 was a year of cyber pandemic. Hackers have taken the advantage of COVID-related digital adoptions in the country, and UAE also recorded about 250% increase in cyber attacks, which were focused usually with techniques like phishing and ransomware incidents, with a high number of rate or degree of success. Moving forward, again, some enlightenment on the top 4 healthcare related security breaches that have happened. And in totality, as per the HIPAA journal, it has been observed that 28,756,000 odd healthcare records have been exposed so far. And the exploits, the fears have been taken towards the escalating situation that has happened amongst the population. Cyber criminals have reframed their phishing attempts to launch targeted cyber attacks by taking advantage of already feared population globally. And number one of the attacks, the Universal Health Services, I think many of us might have been aware of. The ransomware attack across is 400 locations in September. And then data of 5 different healthcare institutions was actually put on the dark web for sale by different hacking groups. And UCSF, one cannot forget this, UCSF, which is the University of California, San Francisco Medical School, they claim that NetWalker ransomware actually affected them, multiple servers, which are very critical, and they had to pay a ransom of about $1.14 million to get out of it. The fourth one being again in October 2020, where DHS CISA issued a warning of Emotet Surgency, which is a very, very problematic ransomware that has targeted almost more than 20% of prominent hospitals. Now, from the agenda, I said that the nation state-sponsored actors are a growing concern, especially when they are targeting the cold supply chain vaccine distribution system. And it is not an easy way to do it, but they have been doing it continuously through cyber espionage techniques. Now let's take an example that, because we all here are quite familiar with Pfizer and BioNTech vaccine, which was the first one to come on board for COVID-19 treatment. And there has been targeted campaign against the distribution of this vaccine particularly. Everybody is aware that the transportation of this vaccine cannot happen below negative 70 degrees Celsius temperatures. So let's take a quick view of how, in short, how this supply of vaccine delivery actually happens. So the new vaccine would need a deep freeze delivery chain that everybody knows, because it has to be delivered at a negative of 70 degrees Celsius temperature. So vaccine is sent to destination in a special dry ice packs, let's say example of 5,000 doses by air. And then the destination country can choose to store the vaccine in a freezer farm that is again maintained at negative 70 degrees Celsius. Now, in the unopened dry ice packs, these vaccine doses can be there for 10 days because it can take around 10 days to reach the government designated or privately allowed vaccination centers. And the final step is, before it is provided to the people, is once delivered, this vaccine can be stored for up to 5 days in a normal freezer at a 2 or 8 degrees Celsius temperature. Now, what happens is that the attackers impersonated a business executive from a legitimate Chinese company which was involved in supply of these cold chain equipment that is used to transport these vaccines. And they did by sending him or her or engaging him into a phishing email. Then they sent some emails that were basically targeted at the transportation system, which contained malicious code. And these emails actually espionage the credentials of people who were involved in managing these transportation systems. Now, this could have been allowed to them to understand the infrastructure the governments are intended or they have made to make sure that supply of vaccine is smooth and is delivered to the people. So such advanced insights into the purchase and delivery and the supply cold chain of this vaccine can impact the global economy as well as the lives, because it's a very, very high value, high priority target. Moving on, we have also observed that nation-sponsored APT groups, that is Advanced Persistent Threats, including North Korean Lazarus Group and Russian Fancy Bear, they have been targeting institutions that have been involved in the treatment and developing or carrying out certain researches on genome studies and vaccine studies related to COVID-19. Another one is where cyber blackmailing is quite popular now, because a recent report has revealed that, especially from the firm Positive Technologies, says half of all the cyber attacks on healthcare were ransomware attacks from July to September 2020. Now, why all of this is important? Because we need to understand that it's a very, very easy payout at this point of time. Attackers now understand that the concept of clinical urgency, if they create a risk and disrupt the ability to provide patient care, they are more likely to be paid than at normal times. Moving forward, as we can see on this map, that the world has been affected globally by COVID-19 and also by various cyber espionage and cyber attacks. The major 6 techniques that have been used by the cyber criminals have been ransomware, emotet-related attacks, phishing escalations. I already told that phishing escalations were one of the keys to the cyber pandemic era that UAE is going through. Web attacks, trick bots, and crypto miners. Crypto miners are the most recent ones, and they will be developed even further as we move into 2021 or towards its end. In fact, emotet attacks are those attacks that have resulted into 20% of the attacks globally in healthcare. So, which is a very, very huge number. So this means that attackers are looking towards emotet as one of their more easily usable techniques and tactic to penetrate organizations globally. And as healthcare systems are not made for security, they are made to save lives. They are made to give proper patient care. So it's even more easier to penetrate such systems and organizations through these sophisticated tactics. So what do we do? See, every part in this chain actually matters. Now, how to protect the healthcare institutions against such vicious and unprecedented cyber attacks in these unprecedented times? We can follow 4 key steps or 4 key areas where we can strengthen our organization's infrastructure. We can strengthen the technology backbones of our infrastructures so that our organizations are more robust and we can deliver better continuous patient care, and have a continuous model of supply chains. Enable multi-factor authentications, continuously do vulnerability assessments and penetration testings to keep on finding those backdoors that can be used to deliver ransomware or Emotet-related attacks. You need to generate more and more awareness. We need to turn our employees into a cyber threat shield, which means every individual or staff is, if vigilant enough, it will be difficult for these threat actors to find an opening for an attack. Increase resilience. This is a key. Increasing resilience is a key because that's the best way to minimize the damage that is caused by a cyber attack, that can be easily achieved by employing better offline backup, storage, and restoration services. Because once you are attacked, rather than going into a mode of payouts or reaching to different organizations, it is best to create the environment as quickly as possible through restored backups and storage solutions. This standard security protocol is especially effective against ransomware attacks. And implementing multi-factor authentications, it's really important that across enterprise networks, it is a very effective way to get rid of some of the most disastrous vulnerabilities that can be left untouched or through your patching systems. It's very critical to follow such simple steps to reach out to better security states rather than having no security state at all. So an introduction to Zero Trust. This is a new outlook of securing the healthcare enterprise, a digitally transformed healthcare enterprise. Because Zero Trust means that you need not trust not even a single device, a user, workload, or system that either it is inside or outside of your security perimeter. This is it looks from a healthcare professional's perspective, where the profession itself is based on trust. It's very difficult to understand this concept because it is where we are not trusting whatever is around us or given us to to provide patient care, which means that you need to explicitly always verify the details, verify the accesses, verify the users, verify the devices again and again to make sure that the devices which are communicating with each other, the devices which are communicating with your EMRs or EHRs or electronic healthcare record systems are trustworthy, are in the similar security state, are behaving normally the way they should behave according to your security policies, so that you don't feel the burden of leftover backdoors in these systems that can destroy your healthcare environment and eventually cause disruption to patient care. Then you need to limit the user access. Use principles of least privilege access and limit the users. Give them access to on need-to-know basis. Not every doctor, every nurse, every physician, registrar, consultant, head of department, directors need access to everything in your environment. They need access based on the work they do. They need access based on the kind of patients they treat. They need access based on the kind of devices they use. So they need to have a profiling of these users, the fingerprinting of devices, and fingerprinting of your network components, the unknown areas of your network, the east to west traffic, the north to south traffic that is coming in and out of your organization has to be limited to be given access to users according to their work and not according to the reputation, not according to the kind of culture you follow. Because everybody is trusting each other as human being, but we cannot trust the devices. We cannot trust the users' actions. There can be rogue insiders who can give out information or can leak out information unknowingly because they might be attacked by they clicking an unfortunate link that they received in a phishing email. So we need to be vigilant and on our toes when it comes to developing these security policies on the devices, which although give businesses the chance of providing good and continuous patient care, but in a controlled environment. And always assume that the breach has already happened. That's the key difference between cybersecurity and achieving resilience, because many people confuse cybersecurity with cyber resilience, but the main difference is cybersecurity always focuses on how you should be monitoring, how you should be putting in preventive measures, but cyber resiliency assumes that you might have been already attacked, that you might are already under attack, and you build the policies accordingly. You test your systems accordingly. You test them for better and better resilience. You achieve maturity, because if you assume that a cyber attacks it cannot be averted, you would make your devices more stronger. You would create policies that are more intelligent and automated, and accordingly you would perform your actions and train your users. So all these pillars come together based on your thought process of looking at your environment. These are the four key pillars to start up with your zero trust model, and it gives you a new outlook on securing your healthcare enterprise. Guys, moving on, we have the other the access, that is limiting the user access, also a key, as I explained earlier. Explicitly verify. That's how zero trust revolves. You can see the shape of this DNA. That's how it should be. Zero trust should be the DNA of your enterprise IT environment, of your healthcare organization. So guys, thank you for giving me this opportunity, and thank you for being patient. Now, I would like to welcome some questions regarding my presentation. Thank you.
Thank you, Ashish Khanna from the Dubai Health Authority, for that fascinating presentation. I'm sure we've got some questions coming in now from our audience. So I know you're sitting there in your office in Dubai. It's beautifully warm there. You've told me it's 40 degrees, which sounds absolutely amazing when I'm sitting here staring out of my window looking at the rain here in the UK. So over to some questions from our audience. How do we stay current on the cyber threat landscape?
See, we need to educate ourselves more. We need to be more aware of wherever we are working, how our enterprise is, which sector we are in, and then accordingly follow some podcasts or news articles on that subjects. Because usually the pillars of cybersecurity remain the same, but they can be translated into different aspects of confidentiality, integrity, and availability as per which sector you're working in. So this is how you can keep yourself updated.
Yeah, that's okay. But if we increase our cybersecurity with new funding and technology, do you think it's possible to end cyber threats for good?
Well, that's where the approach of resiliency comes into picture. The budgets are a concern because it is usually taken as a subject where the return on investment is not tangibly visible like other parts of an organization or an enterprise. But the main thing is that it gives you to achieve the enterprise's cybersecurity strategies, which can help you evolutionize rather than revolutionize the cyber threat landscape, and which adds on to your value in different areas of your enterprise, where you can tangibilize the revenue of organizations and how cybersecurity is helping you achieve them.
So, you know, if you're working in healthcare, you're working in an organization, you become aware that these cyber attacks are so prevalent. How can we convince our organisations that this is a high priority expenditure as opposed to something, because there are so many competing, resources and drags on our resources for basically the money in the organisations. How can you, what do people do to bring this to the top of the agenda?
To bring it to the top of the agenda, the board of any enterprise needs to understand their commitment first towards the cybersecurity of the organization, how it's critical. And then we as individuals who are contributing to the board's vision, we should be able to bring about a cost-benefit analysis of applying these specific controls, which can strengthen the cybersecurity landscape of the organization. And thirdly, what we should do is we should also take into account the risks the organization is operating it, on a daily basis, whichever sector they are working in, whether it's healthcare or non-healthcare sectors. So this helps us quantify the amount of funding that cybersecurity teams receive and what is the return on investment that the board gets out of them. Because at the end of the day, risk is probable, but mitigating it and going to a residual state which is acceptable to the board is where your ROI would come from. And this brings about the acceptance. And as the acceptance matures, it becomes a regular function in whichever program you execute strategically in your organization.
Mm-hmm. Do you think we have all the information we need to oversee cyber risks?
Well, information is the new oil, I would say, in this age. But saying that we have all the information to avert these threats would be, that would be wrong, because not everything can be cyber safe, 100%, and you can never have, enough funding. There was a very famous movie dialogue from the movie of Pierce Brosnan, 007. Which say the world is not enough, right? So you can get as much money as you want, but that necessarily doesn't assure you that you will be cyber safe, right? Organizations like Microsoft, Google have been hacked. Universal healthcare system with 600 plus hospitals has been hacked. I'm sure there's no shortage of money there in their pool. But what we need to understand is the right mindset within the staff is important. That's why in one of my slides in the presentation, I said that make your employees as your shield rather than expecting them to fall trapped to some controls. Make your employees as one of your shields, one of your weapons to against these cyber threats. And it doesn't cost that much to make them. It's just a cultural change which the management commitment can bring about. Enterprises, small or big, doesn't matter. And then eventually, what are the key pain areas where you need technology, and to manage these two, where you need the process. So it's a threefold understanding: technology, people, and process.
And I suppose it's about educating those people, isn't it? Through training, through making them informed about what cybersecurity is and how to minimize those everyday threats that can lead to these massive exposures.
Right. Threats will be evolving always. Before NHS attack, nobody even really cared about ransomware attacks. But when they saw the expanse, how deadly these ransomware attacks can be, especially for a healthcare entity like NHS, which would be thrown away to Stone Age for a week or so, and they would have to spend £1 billion, more than £1 billion to recover from that. And it's not about money. It's about, I can only imagine that how much effort would the providers would have, given in to continue patient care, where you don't have access to the system which can give you the right history of the patient or diagnostic information. It would have been they would have been living in the old age days where they would just rely on their knowledge and experience to assess a patient situation.
Yeah, I mean, you talked about the Pfizer example in your presentation, and so it's not always about money for these hackers, is it? It's not just purely that they want to ransom for money. Sometimes it's disruption, isn't it? Global disruption. So how do you sort of really source about where these likely threats are going to come from and what the reasons are behind them?
See, the likely threats, definitely one of the factors is money, but not necessarily. Nowadays, with the global geopolitical landscape, which is changing, even and not just enterprises, but the all organizations, the nations themselves are becoming competitive, and they are being competitive, and they're comparing themselves to other nations, whether it's national strategies or other infrastructure strategies, health strategies. And health, since the pandemic, health has become a national strategy and national concern for almost all the nations globally. So the hackers understand this sense of urgency, and they know that disruption would bring about disruption in the supply chain of curing the world from this kind of pandemic is also once in a lifetime opportunity. The technology was not available when the pandemic struck about 300 years back. But now technology is available. So the sense of urgency and its disruption is even more of a reason to make them others feel the acceptance of hacking such systems. Because many of the nations or many of the organizations operating in the critical infrastructure space of a country do not really did not used to really report these attacks. But with everything more globalized, internet readily available to access, and people really connected, irrespective of the distances that we are on. Taking the example of this conference that we are having, leaving all these stones unturned is it would be being ignorant. So all these attacks, they are just to make sure that the nations feel the sense of urgency and they can prove a point against each other. And sometimes it's even just a retaliation to an attack which has happened from any other state-sponsored, hacking group.
So you talked about a 250% increase in attacks and cyber attacks, since September, October, and it's just been getting more and more. Obviously, the pandemic has created this opportunity for the hackers. How do we stay ahead? How do we stay ahead of the hackers?
So that's what I said towards the end of my presentation. We need to understand that and move away from the approach of securing everything and anything. Know your crown jewels. Take the approach of cyber resiliency, where you accept that a cyber attack is imperative, right? Once you accept that, you design the controls accordingly, you test the controls accordingly. People have a different level of accountability at different levels or hierarchy of the organization. So they understand, they accept it, and accordingly they function, accordingly they behave, accordingly they culturalize the organization. So this is how you change your mindset, and with the changing mindset you will be able to bring about a change in the threat landscape of your organization as well. It's a thought process that drives the technology and not the other way around.
And if you could leave our audience with one key message today, one key takeaway that they should really, really think about, what would that be?
The key takeaway that I want to bring about from this presentation and from this discussion also is that our global need is best patient care, better patient care, and also to make that available, we are deploying the best in class technology. But we need to also understand and accept that this fact that technology doesn't bring about a change. What brings about a change is your thought process, and you need to understand in your thought process, security is also imperative for these technologies to operate. So these two pillars should go hand in hand: digital transformation, better patient care, and better security, because this is how you continue all the three aspects of your enterprise, especially for healthcare entities.
Thank you so much for your time. Thank you for your presentation and for answering those questions for our audience. That's Ashish Khanna from the Dubai Health Authority. Thank you.
Thank you. Thank you all.
Well, we've had our first keynote this morning, and we'll be moving swiftly on to our next keynote. Don't forget to do that all-important networking. And do remember, if you see a question in the chat box that you like, you can vote for it. You can put your hand on it and vote for it and move it up in the pecking order so that we can actually make sure that that question gets heard. So do put your questions in the chat box so that these can be picked up and I can deliver these to our speakers today. So we're moving on now, and we'll be hearing now from Younis Kazam, the CEO of the Dubai Health Authority.
Good day for everybody. Just want to present it regarding the Dubai Healthcare Corporation strategic overview across that, and what is we are looking forward for this period and the coming period. This is, first of all, we, as mentioned and be known from our leaders, His Highness Sheikh Mohammed bin Rashid Al Maktoum, that with the expansion of the vision, including the strategic oversight for the complete health sector in Dubai and enhance the private sector to have a complete sharing between public and private together side by side. And this would be very clearly this being shown by the establishing of the Dubai Health Corporation with Dubai Health Insurance Together Corporation as well. Going to that strategic pillars as a vision towards the healthier and happier community. The mission is, as mentioned here, forming Dubai into a leading health care destination by fostering innovative and integrated care models by enhancing community engagement. As this and the values, which will be as shown that it is with different aspects going to that engaged and motivated the workforce, that all will be available and will be shared. That efficiency, it is very important to how it will be the efficient the health services. Going to the consumer centricity will be our customer or our patient will be the center of the care, and this is what it will all the modules which is serving the customer, whatever the modules will be as with the specialties provided, that maybe as me will be focusing to the different direction. In particular, will be centered for the patient. Excellence, it is our always and remaining always the target we want to achieve, that whether through the excellence service or excellence center. Excellent services with which will be as a unique and which will be the model can be provided in the hospitals or in service specialty centers. Going further to the innovation, all these services with the patient care will be accompanied with an innovative model that will be showing the new technologies and utilizing what is the newest in the market or in the world available to be utilized for patient care. That is not without the accountability and transparency for the staff and for the healthcare provider. The DHC, which is Dubai Health Corporate, thriving healthcare ecosystem in these different forms as will be competitive and curative and preventive healthcare services through the strategic programs mentioned with different tasks and pillars, whether to be from the patient, improving the income and the financial service experience, and the customer, providing maintaining the specialties or unique services, or adding more by providing the training suitable and opening the field for the research. Regulatory framework, international standards, innovative operational system. As I mentioned, research and study will be part of the strategic, and also it will be needs further support, and looking for that and studying also in the form of their training or studying for providing the required for the research. Building and institutional capacities and competencies as expansion, because increase the population, increase the specialties. There will be also direction for expansion, whether it is in the expansion of the capacity or expansion in the specialties as well, according to the need of the Emirate. Dubai Health Corporate strategic perspectives as integrated value-based healthcare delivery system, clinical governance, risk factor reduction approach. That other one is medical education, professional development. This is what is one of the important to be maintaining the skills and experience in the Dubai Healthcare Corporate and developing also further new specialties or experience as well. Research and development, as I mentioned in previous, that capacity building, world-class infectious disease research, surveillance, and prediction system that is added very recently as what is we gained experience from the pandemic with COVID, that we are looking forward just also to having sort of predicting of each risk and how to be moved forward and to be evaluated and planned accordingly. Further development of public health, epidemic, and communicable disease prevention and control, which is, as I said, was that gained experience during the pandemic, and which is we are concentrating and we are looking forward to develop further. Innovative smart solutions, artificial intelligence, advanced e-health. That is what is really belongs about technology. To be looking at that always to be serving a new look, a new module for utilizing that technology for serving the patient and providing the care required. Dubai strategic plan always that part of it, that looking after that, what is the direction of the as a whole Emirate of Dubai, and to be part of it is the health sector. International recognition, this is also that will be recognized internationally. Each service will be provided, will be recognized, will be accredited internationally, which is we are always used to. A strategic partnership with different institute internationally or locally, whether it is will be in the with the United Arab Emirates or overseas with an institutional partnership, whether worldwide, whether it's an American, European, or the Australian. The other part, which is we are also, we are strategic about medical tourism, that to create a sort of platform for the providing the service required for the tourism with different package, with the services different, and we are looking to have it. We are sort of an excellent service provided for them. Expo, as you know, that we are approaching a couple of months that October 2020 Expo will take place, and all that health sector will be putting in part of our strategic will be that to be in fulfilling all the criteria required for the Expo 2020, whether service or as coverage, and the same with the predicting any emergencies or predicting what are required for the any specialties, whether it is surgical, medical, or as public health. Globalization, and here is what is as will be Emirate of Dubai will be part of that of this globalization, as which is part of it we gained experience from the pandemic, and others which is we wanted it to be developed further. One of that, resilience and agility that has been very clearly observed and noticed during the pandemic, showing that how the flexibilities being provided through the Dubai Health Authority, through that controlling the pandemic in the Emirates. Predictability, as I said, that this is looking further, that always that to predicting for the risk, predicting to be according the act, putting the solution, putting the before occurrence of any situation, to have a solution and to be treated proactively and kept very clearly for preparing the solution and dealt with as well at the same time, timely manner. Integrated comprehensive system, yes, that it will be always looking after that for the different sectors in the corporate, that will be integrated system for providing complete form of the service that each part, even we are considering the private sector part of this system as well. Reflection on the lesson learned, as I said, is very obvious. It is whether to be with the disaster situation, nearby area, internationally, all the lesson we are learning it and we gain it and we bring it here in the Emirates of Dubai, how to make it further, and all the lesson, whether internationally or locally, that any challenges we came out from it, lessons, how to find the solution and how to optimize it. And this is that we are learning, and still we are gaining from lessons from all other partners. As I said, even for other partner in UAE, whether it is Ministry of Health or Emirate of Abu Dhabi. Proactive approaches, as I said, that predictability will be combined with the proactive approach. That is what is giving us a push that to think about this predictability, making us just proactive approach, proactive reaction to catch and to be react, and prophylactic measures to be taken in the timely manner. Rapid response, which is required, and as dynamic health services going on worldwide, is this is what's required. A rapid response required, and this is what we can and what we have assuring for all our sectors and for our government and leaders as well. Adaptability, we are adapting ourselves to the part of the world that what is going on for the globalization, adapting what is suitable and what is from the internationally and what is from the internally, and make it to be adapting to it, what is will be the most appropriate for our service. That I hope was able just to give as a short picture about the direction of the strategic for health sector in Emirate of Dubai, and what it will be reflecting in UAE, and going how will be part of it for international. Thank you very much for this opportunity, and I'm wishing you a pleasant day.
Thank you, Dr. Kazim, the CEO of the Dubai Health Corporation. A real useful insight there into the future of Dubai's Health Authority strategy. Thank you. So moving on to our next speaker this morning, with an introduction to stem cells and regenerative medicine. We'll be speaking and hearing from Dr. Salman Dalvi, the Chief Executive of the Global Regenerative Medicine Society. Dr. Salman Dalvi.
Topic this morning, we are going to be discussing an introduction to stem cells and regenerative medicine. My name is Salman Dalvi, and I am the Chief Executive of the Global Society for Regenerative Medicine. We are based in London, England, and we have offices across the globe, namely in Africa. We have an office in South Africa. We have an office in India. We have an office in Pakistan, as well as New York. The idea today is to make people or the audience get familiar with stem cells and regenerative medicine. Both are integral subjects. One is, you can call it stem cell therapies, you can call it stem cell regenerative medicine. The reason for the topic itself is the body goes through degeneration, and all diseases are degenerative diseases, and we would like to make sure that the body's own building blocks can regenerate the body that is what would be the optimum way to lead into a good, healthy life. So what are stem cells? Stem cells are the body's building blocks. They are cells which are unlike other cells, and they have specialized functions. These are basic cells, and under the right condition in the body, these cells can divide into more cells, which are called daughter cells, either because either of these daughter cells can self-renew and become more specialized cells, or they such as blood cells, brain cells, heart cells, eye cells, and they do this to be able to help the body to renew and restructure itself. So why is there such an interest in stem cells? Everyone talks about stem cells these days. Everyone is trying. There is a big field of stem cells outside, and everyone wants to go into stem cell therapy. What is the real reason? Well, from a research and a doctor's perspective, let me say that there are two things. One is, for the researcher, it increases the understanding how a disease occurs. By watching stem cells mature into cells in the bone, we know how the bone structure is. We know, if we look at the stem cells, how they develop in the heart, we know how the heart functions, how the heart degenerates. If it is nerves, if it is the skin tissue, if it's other organs, we get to know how and understand how diseases occur and what conditions and how they develop. So that's why stem cells are very important to us in the lab or as doctors. The other reason is, if you can generate healthy cells, this can be replaced and regenerate a tissue. So, for example, if you have got degeneration of the knee, and if you can get stem cells and you can plant them into the knee or transplant them into the knee, and the knee can be healed, there is no need to have artificial limb transplants or artificial joint transplants. You don't need to have those. So using stem cells to regenerate a part of an organ is a lot more natural. It's a lot more better, and that's why there is a lot of talk these days about stem cells, and there's a lot of interest in stem cells and stem cell medicine. So people would ask me questions, and I think the question is, are stem cells used to treat patients then? Is that what I am saying? Or is that what the belief is? Well, doctors perform stem cell transplants every day. These stem cells, before we go into that, there are two types of stem cells, two derivatives. These are adult stem cells. We're not talking of embryonic stem cells, which are normally not used these days. We're talking of adult stem cells, which could be in peripheral blood, in bone marrow, or could be collected using cord blood. So yes, transplants using adult bloods are done on a daily basis. They've been done for from the bone marrow, stem cells have been used for transplant to damage cells that have been damaged by chemotherapy or diseases such as cancer. And what happens over there is you take about a liter of bone marrow or 400 mils of bone marrow, and you would then process it from a donor or from the person themselves, and it would go back into the body, and the cells will generate. Okay, this has been used for diseases such as leukemia, lymphoma, neuroblastoma, multiple myelomas. These stem cells, we use adult stem cells over there, which are from the bone marrow. So what would happen is the person would either be a donor or get a donor if it's an allogenic transplant, and you would go into a bone marrow registry, and you would get a match for someone or for similar tissue type to yourself, and you would then be able to use the cells for the bone marrow transplant. Organizations such as the Anthony Nolan, who do a very good job on this, have got a huge registry, and the World Bone Marrow Registry has also got about 20 million plus people registered who are bone marrow donors. The other part which is of interest is, suppose many people in the Middle East or in the Arab world would be able to talk about is cord blood stem cells. Everyone wants to store their own cord blood. Cord blood is a unique product in itself. Okay, when I say it's a unique product, it means it's an off-the-shelf product. What happens? The stem cells that are there, that the baby is feeding on, the blood that the baby is feeding on in the placenta before it's born, is very rich in high, good quality stem cells. Once the baby is born, the placenta is expelled about 9-10 minutes after the birth of the baby, and that is normally discarded. In there, before, the blood that remains in that placenta is very high in stem cells that can be used for stem cell transplant. Hence, there are many companies globally who store cord blood from mothers who have just delivered. And it has become an industry in itself whereby people want to store their own cord blood so that they can use it for either a family member or the child itself in the future. That is something that is possible. In my particular subject, you considered the fact that when you use it for treatment, you will also have to pay for the treatment. So it's a very good idea to have cord blood stored if you feel that you can afford it. But the idea for stem cells, stem cell medicine, or regenerative medicine, and to regenerate cells is to ensure that there is affordability and there is accessibility both together for everyone. It's not a domain of the rich. It's not the domain of a few. When these cells, hematopoietic cells, basic cells, can help regenerate and help in society to help cure conditions such as leukemia, such as sickle cell disease, such as thalassemia, such as diabetes, go and help heal wounds, which are diabetic ulcers, help with shrapnel injuries, help with keloids, help with dry eye disease. Okay, there are a vast number of diseases that can be solved and that can be helped using stem cells and stem cell transplant. Then it should be that everyone should have the opportunity to use these cells. So there are currently a number of clinical trials being undertaken. There's over 9,000 clinical trials which I looked up on at some level. Some are in clinical stage 1, some are in clinical stage 2, some are in clinical stage 3, some are going through the RMAT process, and that they will revolutionize the medicine of the future. Gene therapy, stem cell therapy, regenerative medicine will become something of will be used in the distant future. There are the cases that I know, and when I use stem cells, and when I was involved actively in stem cell transplant, was we would use a mother who would have, say, sickle cell, and a child with sickle cell. I'm remembering a particular subject, a particular client. 3-year-old child had sickle cell disease. There was no chance of getting a match, and the same child the parents had a second baby. They could not. That was not a match, so they decided to have a third baby. The third baby was a match to the first one, and they decided to store the cord blood. We decided to use the cord blood from the third baby's placenta, and then use it to help the child for the sickle cell disease, who had the sickle cell disease. The transplant were very successful, and when I saw the child after about 3 months, 4 months, this little child was so happy, and he said thank you. And I couldn't understand at that stage that how can a 3-year-old child say thank you when he doesn't know what it was going through. The parents explained to me that the child had a stroke before the third birthday. Okay, and by staying up 2 or 3 nights, making sure that we collected the right amount of cord blood, and then transplanted it into this particular child, or gave the child a new lease of life. It's amazing. It was an amazing story, and it gave me a reason to say, yes, this can work. I've also seen patients with leukemia, with sickle cell, with thalassemia go through the same processes, and when they go into full remission, these people are so happy, they're so grateful, they've got a new lease of life. So yes, stem cells are the future of medicine. If you collect stem cells or you get an opportunity to donate stem cells, I would suggest that you go onto a register. Anthony Nolan in the UK do a very good job. Global registries do exist other places as well, and try and join your register, or get in touch with the Global Society for Regenerative Medicine. We also try to help people get accessibility and affordability into stem cell medicine. What is our role as an organization, as a society? Well, our role is to educate the general public on the development of stem cells and the development of in the regenerative medicine fields. We work with organizations globally who are doing research on a daily basis, so we know what's happening. We have got our pulse on the buzzer. We also know the fact as stem cell medicine will cost, and the cost of stem cell medicine needs to be borne by someone. So we have a membership package for our organization for people who are interested in stem cells to get regulated stem cell therapies. If they want to have an affordable therapy to be used, then you can get in touch with us, and we'll be able to suggest methods and ways to do that. So all in all, very short introduction to the stem cell medicine. Yes, it is here now. It has been used for the last 10 to 15 years. There's a lot of talk about it, but there are people who practice it who are not regulated. So you've got to be very careful that you need to go through regulated stem cell therapies. People who are regulated should be the ones who should use it. There are regulatory bodies who make sure that there's quality of stem cells is there. So there is a possibility of storing it for yourselves. There's a possibility of joining a bone marrow registry. In the UK, you've got the NHSBT, which has got its own collection points. Anthony Nolan is a global agency that's available. In America, you have the NMDP, who are also responsible for stem cell transplants. So, as I have explained, all of this is possible, and you can get stem cell transplants. This was a short introduction, and I hope you've enjoyed it. If you have any questions, we'll be able to discuss them at the end. I'm happy to take any questions. Thank you.
So we've been listening to Dr. Salman Dalvi about an introduction to stem cells and regenerative medicine. I'm delighted to have Dr. Dalvi here with us now for some questions and answers. Good morning, it's great to see you, and it was a fascinating presentation. We've got a lot of questions coming in from our audience, so we'll start with the first one. What are the challenges facing stem cell research at the moment?
The challenges, financial for one, okay, that's a nice and simple one. If there is not enough money, there's not enough research. All research have got to go through ethics committees, get approvals. Those are the ones. I think that would be the biggest challenge, is being able to get enough finances, enough funding for the research to go ongoing.
So,
that's a nice and simple question.
Yeah. Yes, that's absolutely great, Salman. What's the ultimate aim for stem cell therapy?
What's the ultimate aim for stem cell therapy? Wow, that is a $1 million question. What's the aim? Majority of diseases that we have currently are degenerative diseases, from aging to knee problems to heart problems. Everything as the body gets older, it starts to degenerate. The aim would be to have regenerative medicine and regenerate each organ. So each organ, each part of the body. For example, we have if someone has a diabetic ulcer, and there's millions and millions of people in the Middle East who have diabetes, and if you can regenerate diabetes and stop diabetes, that as a cure, that would be fantastic. That is fantastic. And on the other hand, those people get side effects of comorbidities such as diabetic ulcers, and to be able to regenerate and re-heal those wounds would be just one example. But it could go on for heart disease, it can go on for autism, cerebral palsy, all the leukemias, all the cancers, millions of cures. So yeah, there's 7,000 rare diseases globally, and if you could get stem cells used for each one of the 7,000, then the 7 billion global population could be connected just with using stem cells.
And this is not life change. It's not sort of. It's life-changing for these individuals that receive this stem cell therapy. I mean, it's life-enhancing, isn't it, for a lot of them? I mean, for illnesses that could be terminal.
Absolutely, absolutely. I mean, I look at it in my career, and I was new to stem cells about 15, 20 years ago, and we just did I was in a labor ward in one of the London hospitals for 36 hours because a child needed stem cells, and I said, okay, we'll collect it for this particular consultant. And we did the collection. 36 hours later, it was in labor, the placenta was delivered. We got 70 mils. I thought that was very good for a transplant. It went out, got the transplant done. And that was it to me. I was, it's all done, fine. 3 months down the line, and in those days, consultants ruled. Consultant called me up from one of the hospitals and said, look, we need you to come over to our hospital within the next 2 hours. I had to drive down there, and after a lot of being pushed around by the consultant and being given vague stories, there comes a 3-year-old boy and says, Doctor, thank you for saving my life. This is the child who had the stem cell transplant. But what does a 3-year-old know of stem cell transplant? And the boy is now about 18 and is in remission, 18, 19 in remission completely, leads a normal life. That is life-changing. That is life-enhancing. And if everywhere, I mean, the African continent is huge. You've got millions and millions of people who are suffering from sickle cell. The Arabian Peninsula has got thalassemia as a disease, diabetes, as I mentioned earlier. If these diseases could be on a daily basis, it would become very affordable to treat stem cells because someone has donated them or someone has given stem cells. It's amazing. That's what real humanity is all about. We've seen that in the pandemic now when people are trying to help each other. Sometimes I do feel clapping hands and clapping utensils for NHS care workers, yes, but those people do 24/7 hard work. Just clapping is not is not enough.
Yes, obviously you want people to donate their stem cells. So we've already found out that I'm too old to donate my stem cells. And there is an age limit there, isn't there? Just tell us the reason for that.
Yeah, the reason for the age limits are one is if by going on the bone marrow registry as we grow older, to obtain stem cells you have from people who are on the registry, you have to hospitalize them for a few hours. You may need to take blood. And as we grow older, our stem cells, again, that are there as with age, they degenerate. And the pain that is there to get involved, the pain threshold is not as good as someone who will be 18 to 20-year-old or 35-year-old. So that's one of the reasons that you have and we get diseases ourselves after a certain age. We get older. So all of those things will make a difference.
So we need to encourage more young people to go onto that database because constantly that database is getting old and the older end of the database drop away, don't they? Absolutely.
We need a lot more people to donate stem cells. And if you are on a register, it helps. Okay, if you yourself are a young mother and you have the facility in your country to donate stem cells to a stem cell bank from the placenta, then that's also very welcome, providing you meet the criteria for that. Then it becomes an off-the-shelf product. Cord blood stem cells are off-the-shelf product that sit in a lab, and as soon as there is a need for it, you can use it.
Okay, and these aren't just transported locally. Stem cells can be transported globally, can't they?
Stem cells are transported globally. It's surprising that yes, we do a lot of transplant. A lot of transplants are done in the UK, but majority of the cord blood transplants, or majority of the cord blood stored in the United Kingdom, is from people of Asian origin who store it for themselves, and then they take it back either to China to get the treatment or to India, which are Hong Kong, Singapore. So yes, and obviously in Middle East, I get patients from Middle East who have come for stem cell transplants to the United Kingdom. So yes, people from Dubai and Sharjah have come. So it is a global movement.
Yeah. So that you've got the donors, you get the stem cells, you find a match. And the stem cells are used for treatment. So what's the success rate of stem cell therapy?
Well, the success rate depends on many different things. Outcomes are very good for for things like leukemia, sickle cell anemia, thalassemia, but there may be some comorbidities. You see, people don't die of stem cell of any diseases. They may be dying of the comorbidities that are there with the illness. But wherever I've seen stem cell transplant, if it is, the rate has been 80%, 85% success rate straight away to up to 100% in many cases. It depends on which disease is being looked at and where stem cells are being looked at. For example, stem cells, I'm not talking futuristic, but if it is a shrapnel wound or a burn wound, it's 100% by grafting. Okay, so then that's what would be you take the stem cells from the amnion and you use them, or you use a stem cell for dry eye therapy. They're 100% treatments.
So which country has the most advanced stem cell therapy system? Which country is far ahead, way ahead? Obviously, you're going to say UK here.
No, it's very difficult to say that because good work is being done globally. Japan, Korea, United States, In the UK, we are doing extremely good work as well. Israel is doing some fantastic work. Even Iran and even the Middle East, okay, have got centers that are doing good work. The question is funding for the research, okay. As I said earlier, I started it off, the obstacle is funding. If there is funding, and if there is a global movement, and which is now there, the global society that I work with, whereby you have funding for the treatments as well, in the form of a warranty that will be allowed, or that will allow, then life becomes easier. But yes, stem cells are used globally. United States obviously claims to be the leader. Russia and those areas, China claims to be a leader. There's thousands and thousands of papers out there, and people are doing work. But the idea is to have regulated stem cell therapies. Don't go to a clinic that suggests, oh, I can do stem cell therapy for Alzheimer's, and you pay $3,000 and get a treatment, and then 2 months down the line, you have got to pay another 3 months, another $3,000 for a booster dose. That's not the idea. The idea is to get a treatment. Yes, it may be 6 doses for a particular treatment, but they can be done. You don't charge people accordingly. You tell someone, this is the charge, this is what it is, this is the affordability of it, and then you carry on. And currently, 1 month is $3,000, the other month is $5,000, and there's a lot of clinics who are duping people because the results are not there. You should always look at, is this clinic reputable? Is this area, is the work being done really correct? Is the doctor reputable? Who has, how many papers have been published by this doctor to be able to say that, yes, I can do this particular thing? Because it's very easy to collect something and just inject it and say, yeah, I can work, I work, but we need to know outcomes. You asked the question, what is the success rate? Success rate, outcomes are very important.
Yeah. And you talked there about it being you're from a global society. You want countries to communicate with each other about this. You want this to become a global result whereby the affordability isn't a factor. It becomes accessible to all. That's the key, really, isn't it?
That's the key, because the cells are within you. Okay, every country has got a major cell bank in itself. If every country was to provide enough funding for their centers and say, okay, stem cells can be used for this, so we will say knee replacement, so much a fund for knee replacement. Diabetes will allocate so much. This will happen. This will happen over the next 10 years, 12 years, 15 years. And for those countries that are not there, that don't have a healthcare system like we have in the UK, we will have people wanting to join or take a warranty out, who will say, okay, we will, providing today you don't have a degenerative illness, you pay, say, £10 a month or $20 a month, and if you were to get a degenerative illness in 2 years or 3 years time, there will be a pool of pot, maybe $50,000, maybe $40,000, and that would be available to pay for the treatment or costs around the treatment, and that will make it affordable for everyone. Someone from Africa or someone from Bangladesh or the poorer third world countries should be able to access stem cells as much as a person from the United States or the Arab world.
Yeah. So what's the one key thing that you want our audience to take away from your presentation today?
The key thing is, if you have the availability and therefore to join the global register, and please do that. And if you don't have that, try and donate and talk about it with your friends, that global regenerative medicine is here. It's going to be the future of medicine. Stem cells are the future. So please just communicate, talk about it, make it an issue, make it a global issue, just like we've just done with the pandemic and the COVID-19.
Yeah. So thank you so much for your time, for your presentation, and for answering those questions for us today. That's Dr. Salman Dalvi from the Global Regenerative Medicine Society. Thank you.
Thank you, Sandra. Thank you very much.
So that concludes the presentations for this morning. We've got more for you this afternoon. We've got a break for lunch now. I just want to remind you that you have got your platform there. You can continue to network, you can continue to collaborate, and you can arrange those important follow-up meetings. We want you to communicate, we want you to get to know each other, and we want you to talk globally. Don't forget, we've got the hashtag for you to use as well. And also we will be taking questions from this afternoon's topics. So I think we can just have a quick look at what we've got coming up this afternoon. We've got from UKIMA, we've got Jenny Scott, expertise in the global healthcare market. And we've also got Ghafoor Ahmed, who'll be talking about the future of healthcare billing. So I'll leave you for now, and I will be back this afternoon to talk to you a little bit more. Welcome back. I hope you enjoyed your lunch and I hope you continued to network. My name is Sandra Garlick and I'm your host for today and moderator. I just want to remind you a few things. Remember to use that chat box. It's there for you to network. It's there for you to talk to each other. And it's also there for you to pose questions. And remember your platform. It's there to connect, to network and to collaborate. We had some great presentations this morning and they will be available to watch later on the Future Health YouTube channel, as will all the presentations from the 3 days. We're now moving on to our afternoon's programme, so just a reminder of what's coming up ahead. So first we'll be hearing from Jenny Scott from UKIMR about the expertise in global healthcare market, and then we'll be moving on to our final presentation of the day from Ghafoor Ahmed, who'll be talking about the future of healthcare billing. So on to our first presentation this afternoon, and over to Jenny Scott, the General Manager from UKIMR.
Hello everyone, I'm Jenny Scott, General Manager in UKIMR, and I'm delighted to have been given this opportunity to tell you about UKIMR, who we are and what we offer international clients. So UKIMR stands for the United Kingdom International Healthcare Management Association, and we're a national organisation, membership trade organisation, established to provide expert integrated healthcare solutions to international clients. Our membership base ranges from large global multinational companies through to small SME niche companies on the commercial side, but we also have a number of prestigious NHS organisations and increasingly academic bodies, universities and colleges. And so all of these organisations are formed under the umbrella of UKIMR and all offer a particular expertise to the international market. We were established about 8 years ago as a vehicle through which the UK could offer its expertise to the international healthcare market. And so we can tailor our solutions to whatever our clients require, be that a large scale capital build with all of the elements within that, or a very defined data or education ask. So we are uniquely placed to offer these tailored turnkey solutions to international clients. The capabilities that we bring to the international healthcare market are very widespread. As you can see from the slide, we offer expert clinical advice. We do have a number of NHS and private clinical organisations involved in UKIMR. And so if you're looking to develop clinical services or perhaps optimize existing services, we're able to work with you in working through what your needs are, what the driver for change are, and then some examples of models that may work well for you in your healthcare facility. We have access to finance. UK Export Finance is one of our partners. We work closely with them, as well as other financial institutions, in being able to offer funding for particularly capital schemes abroad. We're also able to advise our clients on how to access funding for particular schemes. We have a range of experts around our healthcare facilities, and I'll be telling you a bit more about this during the presentation, but we're able to work with clients in the initial scoping and feasibility of a large-scale capital scheme. We're then able to look at the planning, the building, the designing, and the commissioning of those facilities. So our membership includes construction companies, architects, engineers, designers, project managers. So we bring the whole package if you've got a large scale or even a small scale capital infrastructure project. Increasingly important to us is our education and training offer, and I'll be telling you a little bit more about that later on in my presentation. But we're able to work with clients in offering the full range of education and training from formal academic education through to specialist training. Digital and data technology is becoming increasingly important. We can work with clients around demand and capacity modeling, around AI utilization, around digital systems in business working, but also we can use our digital and data technology in supporting our other areas, such as delivery of education and training through digital learning platforms. We also have a number of companies who are able to provide specialist equipment, and we've just established a life sciences special interest group looking at medtech, drugs and devices, and being able to offer that UK expertise to the international market. So as I mentioned, we do have a number of prestigious NHS organisations in our membership, and they range from oncology, cardiac, mental health, rehabilitation specialists, and they are the more tertiary specialist hospitals in the NHS. So they bring their expertise and their knowledge on the whole range of services that they cover, and that's from service design, delivery, the equipment required. So if you're looking to establish a specialist hospital, tertiary hospital, then we have members who can offer you their expert advice. We can support you in terms of developing specifications if you're going out to procure services. We can also advise you around service specifications for delivery and also standard operating protocols. So whatever you require in terms of the healthcare expertise, we have a member who's able to offer you that. So as I mentioned, we have a number of special interest groups, and all of our members are on one or more special interest group according to their area of interest. And the special interest groups reflect the capability and expertise of our UKIMA members. So in terms of education training, we have both NHS and private education training providers. Each special interest group has 2 leaders, and I'll be saying a little bit more about the 2 leaders of the education group in a bit. But that group then can offer the whole range of education and training that you would require for your healthcare schemes. We offer consultancy advice, and that's a very broad range of advice, from clinical consultancy through program project management, legal finance. We'll be able to provide you with advice in terms of getting going on your project and delivering it. As I've mentioned previously, we have expertise in health infrastructure, and I'll be giving a few case studies of work that we have been involved in that. Healthcare operations and management, once you have your facility, you'll want to commission that, have it equipped, and you may want an operator to support you in operating that on an ongoing basis. So we have some very experienced operators who are able to work with you in driving that forwards. Digital data, I've mentioned. We have a range of organisations who can offer the full spectrum of digital and data technology capability. We then have a number of task forces for specific focus on key areas. We've currently got a Middle East and North Africa task force, but we're developing other task forces to reflect the wishes of our clients and the requests that we receive. We have special projects as well, where we do a time-limited piece of work, and I'll be giving you an example of one that we have developed and that we can offer you if that fitted your requirements. We also have a COVID-19 offer, where we as a collection of members can offer a full range of support, and that's ranging from the physical support around pop-up facilities or short-term medical facilities that you require, the equipment and other elements such as PPE that you require, but also once the surge of the pandemic may have passed, it's how we then support you in that recovery phase, getting services back up and running, and looking at your resilience and your capacity building for the future. Excuse me. So I first wanted to start off with our special interest group in digital and data. And where in this group, we're trying to drive advances and innovations in using digital and data technology. So we do have a number of organisations involved in this group, and every one of our special interest groups has a detailed brochure which articulates the offer they have, the members, gives you access to their website so you can look at those, and it shows some case studies of work that has been undertaken. So those brochures are all available on our website, and I'll be giving you the address at the end of my presentation. So this one is the digital and data, and what this SIG offers is data-driven business strategy, looking at AI, looking at patient and medical records, electronic patient and medical records, and looking at how digital innovations can support driving your business strategy. You may also want some demand and capacity modelling. If you're looking at some of your services and you want to know, you want to future-proof your facilities, we can support you in that demand and capacity planning around your patients and activity. So just a couple of case studies from our digital and data special interest group. This is one by one of our special interest group leaders, Methods Analytics. And this is a case study where Methods Analytics worked with the Care Quality Commission. And the Care Quality Commission is the independent regulator of health and social care facilities in England. Now, they go into all health and social care facilities and they inspect them against key criteria, and they'll write up a report, and that organisation will be given a rating in terms of the outcome from that inspection. So clearly the inspections are very much data and information driven. There's a lot of information that's collected, but a lot of it is disparate pieces of information, and a lot of it is free text and narrative as well. So the CQC and Methods Analytics work together in looking at developing a decision support tool around those inspection visits. And Methods used AI in terms of collating all of this information, narrative and data, and developed a decision support tool that the inspectors in the Care Quality Commission can use to make sure that they've gathered all of the information, they've taken account of it all, and that it can support objectively in driving forward their work. Another area that we have specialism in is through a company called Patient Source, and they also co-chair our special interest group, and they offer expertise in electronic patient records and electronic medical records. And so what they're able to do is take disparate data silos and integrate them so that you as a client can see the whole picture around the data that you have, rather than separated silos. So this very much is an integration engine for use in your clinical systems within your facility. Moving on now to the infrastructure expertise that I've mentioned at the beginning. Again, we have a brochure that details the members and the offer. And as you can see, our expert offer in this special interest group spans the planning phase, and that might include the feasibility of a particular project, the legal and finance elements. And as I said, we can advise you in terms of sourcing finance for your scheme. Through to the design, we have some very prestigious designers, healthcare planners, architects as our members. We then move on to the building and equipping. So we have our construction firms that are able to work with you, and we very much drive innovation and new models of healthcare facilities with a strong emphasis on healthy buildings, looking at how we look at that holistic building and its contribution to health and well-being of patients. And we look at green facilities as well, energy efficient and sustainable facilities. We then move on to the commissioning and maintaining. So we can commission equipment, buildings, and then we can also support you in maintaining and checking back on the effectiveness and the efficiency of that healthcare facility. This is one example of one of our members, ETL, who are experts in strategic planning and strategy development, looking at clinical models of delivery and also looking at the demand and capacity planning. So ETL have been working with the Hamad Medical Corporation in developing and advising on the Hamad bin Khalifa Medical City development, which is a very extensive, prestigious development in Qatar. So they have been able to work alongside the client in looking at the need, in looking at the population, projecting what the need might be in the future, and then in designing innovative buildings that will be flexible, but will be future-proofed for future growth in demand. Another case study from this particular group is the work that we've been undertaking in Greece. And there are a number of our members involved in this initiative. You can see Llewellyn Davies as architects, ETL as that strategic service planner, Arup in terms of construction and design, and Mott MacDonald's. So this lineup of very well-known, globally influential organisations have been working with the healthcare planners in Greece around a number of new healthcare facilities. And in some of these, we've been working with the world-renowned architect Renzo Piano to look at innovative design that's sympathetic to the environment, but that is sustainable and green. And one of those facilities is a new paediatric hospital in Greece. So this has been a real collaboration with the healthcare planners in Greece. And this is really an example of what UKIMA can do. We pull consortia together across the full spectrum of our members to tailor our response to international clients' requirements. Moving on now to education and training. This is increasingly important, and post-pandemic, with the pandemic with us, we've had rapid digitization, and so we are able to offer a range of support through digital learning platforms, which is much more flexible for our clients. But we know that you can have a beautiful new building with lots of equipment, but if you don't have a skilled and expert workforce, you will not deliver excellent clinical care to your patients. And so this is really an increasingly important area for UKIMA, and we have a fantastic group that can offer expertise across the spectrum of education and training. So as I said, fundamental to the delivery of world-class clinical care is having that expert team of professionals. So we can offer support and training across the full multi-professional team, and that's your doctors, your nurses, your allied healthcare professionals, but also administrative and managerial staff. So that full spectrum so that you can deliver excellent care to your patients. So we bring together both commercial sector education and training providers with our NHS partners and increasingly universities and colleges. So we can offer that spectrum. And these are just some examples of the members who are in UKIMA who offer these facilities. eIntegrity is a company that offers a vast range of online courses and modules, and so you can see a whole menu, and that ranges from things like first aid training, emergency planning, it might be palliative care, so that full spectrum, they're able to offer you that. Pearson is one of our co-chairs of our special interest group, globally influential in education, and have a fantastic offer that they can provide. Advanced Clinical Solutions, again, an independent company that has a lot of experience both in the academic world, but also in specialist clinical skills training. And one example there of our NHS provider is the Royal Papworth Hospital, who can speak from experience and offer their expertise via digital learning platforms. So the expert offer of the Education and Training Group spans from workforce planning. You might have established a new healthcare facility and you're not quite sure what professionals or how many or what grade you would want in that facility. And that might grow over time as you expand your healthcare services. So we would work with you in terms of planning that workforce, in terms of numbers, grades, the kind of skills that you would need in your particular facility. We'll look at the clinical skills training required of those staff. We'll look at the academics. So we work on both undergraduate and postgraduate education, and we offer a range of support there. We work closely with a number of universities and with Health Education England. So that more academic formal training, we're able to facilitate your access to that, as well as the on skills training of your multi-professional team. Another area that we can offer is in terms of your clinical fellows and observerships. So if you were interested in some of your medical team or nursing team coming over and working alongside some of our prestigious NHS organisations, we can facilitate that. And that might be 1 or 2 year clinical fellowships, or it might be much shorter term clinical observerships. But whatever you felt you required for your workforce, we're able to offer that. So as you can see, our delivery methods are through e-learning, online digital learning, face-to-face, and also blended, a blend of those delivery methods. And so, you know, when we're able to, we are able to come onto our client sites, or our client can come to us. So completely flexible, but with this digitization and the learning platforms, we're able to offer you access to those platforms from your own location, and then you can take those take yourself through those courses at the pace that you want to do. So moving on to our consultancy special interest group, we offer that full spectrum of advice. So we marry up the specialist clinical advice from our Centres of Excellence, NHS Excellence, and you can see a number of those listed there. We combine that with the specialist expertise of our commercial members, and many of them have been consultants, management consultants for many years. They have extensive experience. We have legal, financial, program management experience. So we're able to offer that full package around the clinical and delivery aspects of your requirements. So the expert offer, that just shows you what I've said. It's a whole range of offers according to what the need is. Just a couple of examples of our members. So Arup, one of our members in the consultancy special interest group, has been working with the healthcare planners in Australia around establishing the new Royal Adelaide Hospital, which is a $1.85 billion prestigious tertiary new centre. As you can see, very innovative design. And so Arup have been working with them in terms of from that initial feasibility to developing that facility, as you can see there. Another one that our members Foster and Partners have been involved in is this very innovative design for a Maggie's Centre in Manchester, which is next to the Christie Hospital, which is a major oncology tertiary centre. Now, the Maggie's Centre offers non-clinical advice and support to both oncology patients, cancer patients, and anyone affected by cancer, so that may be their families as well. And this is a lovely centre which is very informal, and people can go seek advice, attend classes, or just go and sit there and just be quiet. It's a lovely facility with open plan areas. People can sit quietly, or they have a garden area where if people would like to do a little bit of gardening or just be on their own doing a little bit of wandering in the garden, they're able to do that. So it's a beautiful facility, and so Fosters and Partners have worked to help design and make that happen. So in terms of the operators, I mentioned that we have a number of companies that can support in commissioning and operating healthcare facilities internationally. And they bring extensive experience, that many of them have been doing this for decades. So they bring their experience in both the commissioning and the operating of facilities, but also in assuring the people that we work with, our clients, around the efficiency and effectiveness of that facility. So is it running really effectively? Is it driving value for money? And we will work with clients in terms of evidencing that. So the offer in this particular special interest group covers from that initial scoping, and you can see a number of the special interest groups overlap with one another. They're not separated. They do very much work across each other's boundaries. So we can support around the scoping, the feasibility of a scheme, the commissioning of that facility, the operating of it and the longer term, and then that assurance around value for money and effectiveness. So these are just three of our global operators: Pioneer, International Hospitals Group, and OCS are highly experienced operators of healthcare facilities, and they would work with you to provide you with that assurance. So something that we've been developing is around creative problem solving, because sometimes people that approach us, they're not entirely sure what it is that they want. They know that they have a need, but they have either faced challenges in taking that forward, or they'd just like support in articulating that need and really getting going in meeting the need. So we've developed an offer whereby we would work closely with a client to help them articulate what the need is, their healthcare need, and perhaps any barriers that they've been facing. We'll field a team that's relevant and appropriate to that need. So it might be cardiac facilities, it might be diabetes, it might be provision of virtual clinics, whatever the requirement is. We'll field a team with the expertise to facilitate an exploration of that issue. So we'll hold workshops, virtual workshops at this point in time. The expert team will work with the client. We'll have a questioning and sharing of ideas and exploring of options session. And we will then present a table of recommendations for action, options to take forward. And if the client wanted to, we could work with them in terms of developing business propositions around that. So this is a new exciting area for us. We're going to be taking it forward with a number of different colleagues in different countries. And so if you wanted to find out more about how we could work with you, then please do get in touch with us. So in drawing to a close, the commitment that we offer international clients is to support them in realising their ambition for excellence in the care they offer to their patients. We've spoken about the expertise and the knowledge and skills that we could bring, but we would work alongside a client, recognising that they want to offer that excellent clinical care to their patients, and we want to support them in that. What EUKIMA brings is a vast range of UK expertise across the full spectrum of requirements, and we can then work with our clients to develop solutions and options that will take them forward to meet their needs. And then what we offer is respected and trusted organisations. Our members, many of them are internationally renowned organisations, and we bring them together under the EUKIMA umbrella and offer their expertise to international markets. So in drawing to a close, I hope that's given you a sense of the passion and the ambition that EUKIMA has in working with international clients and the international healthcare market. We'd be delighted if you got in touch with us to just talk about how we might work with you. And our contact details, you'll see there, the email is membership@eukima.co.uk. But also we've just launched our new refreshed website, and a lot of the information that I've spoken about is on the website, and you'll be able to then see a little bit more about us and perhaps get in touch with us. So please do visit our website, and happy to speak to you if that would be helpful. So thank you very much.
Thank you, Jenny Scott, the General Manager from EUKIMA. That was a really informative insight to the work of EUKIMA. And don't forget, Jenny said they've got their new website there, eukima.co.uk, if you would like to find out more. We're now moving on to our closing tech talk, the final presentation from today and the final presentation from Arab Health Week. Do remember to post your questions into the chat box, and you can vote for your favourite question, which pushes it up the rankings. So we're going to be hearing from Ghafoor Ahmad, the founder and CEO of AGA Medical Billing Services, who's going to be talking about the future of healthcare billing. Over to you, Ghafoor.
Involving payments from the government and commercial healthcare insurance companies. Medical billing processes are being sufficiently automated at a rapid pace, with more doctors, hospitals, and medical facilities switching to secure online patient management system. According to Harvard Business Review, the healthcare industry accounts for 30% of all the electronic data storage around the world. A large part of this is in the form of unstructured data filled with the key medical facts and information. RCM companies have invested in setting up the foundational building, blocks of analytics, emerging technologies, compiled with the advance in computing power, offers the next step for the organization to drive insight and improve the financial and operational performance. Now, while medical billing softwares is an important part of any practice, providers run into a large inefficiencies and problems with their software. The reason is that the adaptability and the full integration with their current technologies. There are 750 billion rejections per annum. 250 billion is the admin cost because of the insufficiency of the system. And there's a lot of disconnectivity and the workflow. And there's medical coding and training program that needs to be done for all these providers. Now, what I think and what the future should be. So the future of medical billing is that as today, healthcare system becomes more value-based, new technologies in healthcare need to be utilized at a scale of the organization to leverage emerging technologies like blockchain, artificial intelligence, and cloud computing to improve the performance and the outcome. Now, if we talk about blockchain technology in healthcare billing, blockchain can provide powerful solutions to minimize medical billing related frauds Blockchain contains an inbuilt identity mechanism, a cryptographical secure public, private, and key pair to use to associate activity on the network with a specific participants. This would ensure each penny paid is tracked by automating the majority of the claim adjudication and payment process activities. Blockchain system could help eliminate with traditional and clearinghouse to reconcile the current layer of the system. Now, the other important element is robotic process automation. With PRA, health insurance eligibility check can be automated with the retrieval of the coverage data from the insurance sites, catching potential eligibility issues early in the revenue cycle. If the provider needs to rework 500 claims per month, it would require more FTEs who can work in a day or two on the new claims. This could be automated by robotic process automation, scripts resulting in rejection, automating payer calling for details, determining coding mistakes, refiling the claims, or filing an appeal. Now, I would say that big data and analytics solves the revenue leakage. This would be the biggest contribution to the revenue cycle management, as the primary object of an RCM company is to augment the billing process in such a way that a healthcare provider can run a profitable practice. Now, registration data, clinician data, financial data, and claim data are high in a volume and require extensive mining of data. As per HFMA, out of the 1.4 billion claims submitted annually, 200 million are denied out of every 7, which costs around $5 to $10 million each year. Now, big data technology can be used for RCM data integration, management and processing. Denial rates can be reduced or even eliminated through RCM big data analytics. Now, the most important role artificial intelligence can play, and this is where the future is actually, that healthcare data, when compiled with efficient algorithm, can provide deep insight and knowledge around improving different RCM processes. Machine learning algorithm and natural language process algorithm can be applied to applications such as intelligent alert of denial risk, medical coding error, deduction, claims, administration accounts, receivables, and denial and the recovery of the claims. Also, this can help the healthcare providers to help them with their claim automation and one-chip record, which can be introduced to the current system that is out there. Now, every year, a lot of healthcare providers lose so much money, or there's a lot of administration burden because of the current processes. Thank you. If you have any questions, inquiries, I'll be more than happy to answer.
Thank you, Ghafoor Ahmed, founder and CEO of AGA Medical Billing Services. Please pop your questions into the chat box if you have any questions there for Ghafoor. And we'll just have a chat now about some of the things that you've been talking about. And you mentioned one of the key things there was the amount of money lost due to inefficiencies. Is this because people don't understand the technology that's available to them, do you think?
Yeah, I think it's not only because of the technology. Yes, one is that they're not aware of the technology. Second important thing is a lot of doctors, especially the physicians who are running the practices, are not really tech driven, or not really into the technology, because their main focus is to make sure they're treating the patients right. And this part is broken. The billing part is broken. And I would say that it is because of most people are not aware of the technologies. They're not adopting the new technologies and the changes in the system. And the second thing is because they have a less staff, like they don't have proper medical coders and medical billers in place. That could be one of the reasons.
Do you think that's a fear of change, a fear of new technology, and a fear of what's coming ahead?
Yeah, I would say a fear of changing adoption of new technologies, I would call it.
Yeah, and these billing systems, are they easy to operate? Are they would they actually save time if they were implemented in the correct way?
Well, very good question. So mostly there are legacy systems out there from 90s and 2000s, right? So they're not really up to date. So I don't say that the platform they're not using. They are using the platform, but they're really outdated in legacy systems. Now, with us as a company, Claim.ai, what we've introduced is a very latest technologies, AI-driven platforms called Claim.ai, which is basically, we simplify the whole entire process for the physicians, because in those legacy system, you will get to see, so many options out there and you get lost. So what we came up with is with a new technology, which is completely AI-driven. We use data science pretty much for claim scrubbing, and we have the Elasticsearch in place, very latest technology, which helps healthcare providers to eliminate the rejection, because the system is smart. It automatically deducts the error. It automates, like most of the things. What the system does is automatically does it by itself, rather than you have a human interference, and there's a lot of human errors in between. So our system does most of the things automated for the providers, and yeah, this is one of the things that actually helps them reduce the rejection.
Yeah, and you mentioned a huge amount of claims denied there. I mean, those claims denied, the cost that surrounds that, surely the cost of implementation of a goods billing system would far outweigh the loss of monies from the claims denied.
Yeah, I mean, this could be prevented because with the latest system that has been introduced in the industry. As you said, the biggest problem is adoption of new technology, right? So, like, for example, if a physician has been using a system for 3 to 4 years or 5 years, for them to change, it's a lot of work, to be honest. Like, literally, they need to train, and they don't. Like, I don't call it they're lazy enough, but I think when there's a change, it takes time, for the new adoption. So I think if they will get into this smart platform that we're introducing currently, is going to make their life really easy. Not only this, but the money lost, but there's a revenue loss, which is huge. You can imagine $252 billion annually in rejections because of the human error, because of the systems are not efficient, and healthcare providers suffer because of that.
And this artificial intelligence, really, it is able to make those decisions and take that room for error away. Is that correct?
That is correct, exactly. With a big data and with a machine learning algorithm, yes, definitely, it is overcoming that. So
how do you convince organizations and medical practitioners to actually make that change? What would you say to them are the huge benefits to making those changes?
Well, I could say that currently we are experiencing that ourselves in the market, that when you show them the statistics and the real-time data and the real-time dashboard, and you can literally show them how much money they're losing, everyone wakes up literally. But then again, obviously there are a lot of decision makers involved. They cannot make like a decision right away. But yeah, I think now the awareness is out there, especially when it comes of losing revenue, and you show the track record of what they have done in the past year, what they have done currently, and the kind of revenue they're losing. Yeah, they kind of wake up, and I could say that it's now people start realizing in the industry we need to adapt to a smart technology.
Absolutely, I think smart technology is where the future is, and especially with AI. medical practices, the organisations that they've got these legacy systems in place, and we've already said they fear change, they don't like change. So what's the sort of, can these systems be implemented into any size of organisation, or are they just for the big organisations with large amounts of data?
Well, the current platform that we introduce is for everybody. It can be a small, medium, single standalone pharmacy, or a clinic, or a hospital, to group of pharmacies, or group of chain of hospital for a larger enterprise level. It's available for everyone.
And we heard about earlier on this morning, we had one of our presenters talked about cyber hacking and all those sorts of things. How safe are these AI systems, do you think? Well,
I think if you compare it to the legacy systems or the systems in 90s or 80s or 20s even, the cloud-based AI systems are, when it comes to cybersecurity, it's like, I would say there's 80 to 90% is very secured, because the way they have built it, keeping all this cyber attacks in mind. And I think I would say it's like 80 to 90% more secure than the legacy systems.
Thank you for that. So what's your biggest challenge now, do you think, going forward?
Well, I think for us the biggest challenge, because we're in the MENA region, and we're literally going to the whole entire GCC market. We are now in Saudi as well. So for us is the biggest challenge right now is the adoption. To be honest, it's gonna take a bit of time, but for us the biggest challenge right now is to changing people to the new technology and adoption of introducing them to the latest technology, and for them to accept the change and adopt the system.
So for our audience today, what thought would you like to leave them with for today? What's the one thing you would like them to take action on after leaving this presentation today?
Yeah, I would say for the healthcare providers, especially people with clinics, hospitals, pharmacies, laboratories, anybody in healthcare space, I would say that they should be open to adopt the new technologies, especially any system that's AI driven. There's machine learning involved. They should be open to it, because if they are going to encourage these systems, it's going to be efficient. Like, everyone's life is going to be much more easier. It's gonna, as I said, on blockchain, it can detect a lot of frauds, abuse, which happens in healthcare claims management. So these things are going to make their life a little easy. So I would say be open to accept the new technology, especially anything related to AI and ML.
Well, that brings us to a close. I'd like to thank you for your time and for answering my questions. Thank you for your presentation. That's Ghafoor Ahmad, founder and CEO of AGA Medical Billing Services. Thank you.
Thanks for having me. Appreciate it.
So that brings us to a close. That's the end of our presentations for today and the close of Arab Health Week. I hope you've enjoyed all the presentations over the last three days. And don't forget, if you've missed them, they are on the Future Health YouTube channel, and you can watch anything you've missed, or you can re-watch anything you are particularly interested in. Thank you to all of our excellent speakers and presenters. I'd also like to thank you for attending and for your valuable input and questions throughout the 3 days. Please remember to continue those conversations, those connections, those collaborations, and don't forget to arrange those important follow-up meetings to continue to network globally. The live stream here will close shortly when we finish, but the platform will remain open for you to continue your networking. So do remember to make those important connections. The next in the series of these series is the Africa Health Week, which takes place from the 12th to the 14th of July. So you can register now for Africa Health Week on the Health Week Series website. It's healthweekseries.com, and just click on Africa Health Week. That's the 12th to the 14th of July, and we hope to see you there. So it just leaves me to say again, thank you to all our presenters. Thank you to everyone for attending. A good afternoon to you all, and thank you for your time.